Hello, everybody. Welcome back into Talking Fitchburg. Joining me today from the Fitch-Rona EMS service and more. I know it sounds like it needs like this real cool, like, and more. We got your Deputy Chief Jeff Dostalek, who's asking, why does he keep coming back? How you doing, Jeff?
Yes, I'm doing great, and I am not much more than what you see right here. This is just all me.
This is as much as you can.
But thanks for
right
the compliment.
Oh man. Well, I've asked Jeff here today to talk about all the great work that you guys have done and continue to do at Fitch-Rona EMS. I think it helps paint a picture on how the tax dollars are used, how the training is done, and leading to what is Fitch-Rona doing out there. And you guys are a very busy service. There, if not familiar with the EMS world, you guys like second to, I don't even know. I'd love to know the statistics versus you in Sun Prairie, because that's got to be pretty darn close.
We're a bit busier than Sun Prairie, but not much. So
there you go. But yeah, Jeff, you're going to break it down for us today, kind of looking back at 22 and then a little bit into 23. We'll peek ahead here. But let's just start overall with calls for service, because that's kind of the bread and butter, if you will, of what you've been doing out there. So sure. What's the number?
Sure. Yeah. Calls for service. So every year when Chief Anderson puts the budget together, he usually configures about 3% increase each year. Last year, at October, we picked up the former town of Madison area. And that certainly is going to add to our volume here, moving forward. So last year we finished at 4,267 calls. That's compared to 4,184 calls the year before and 3,505 calls in 2020. So we saw a 2.3% increase from the previous year for our call volume. So we were right on the mark with that. We had a couple pretty busy months, January and December of last year, 14% and 12% respectively. But then we had some slower months over the course of the year, where we were below what we did the previous months. But overall, we did increase 2.3% in our call volume. And if some people are wondering, we break the district down, obviously our service district, the city of Fitchburg and city of Verona and the town of Verona. And then we break it down into some other areas. So for the town of Madison, if anybody was interested, year to date last year, we picked up nine calls from the years prior. 2,676 calls in the city of Fitchburg. And I'm sorry, I'm looking away so I can look at this.
No worries.
1,097 calls in the city of Verona and 155 calls in the town of Verona. So city of Fitchburg is about 63% of our call volume, the city of Verona 26%, and the town of Verona is 4%. And the remaining percentage of that is going to be other districts such as Mount Horeb and Belleville and outside areas that we go to.
Jeff, if you're going to put this together, as far as how many ambulances are we talking about that are fully staffed each day to cover the 4,000 plus calls a year?
Yep. So we added 3 years ago, we added 2019. We added an additional ambulance to the daily rotation. So we have 3 fully staffed paramedic ambulances, one here in Verona at the fire station, and then one at each of the Fitchburg fire stations, Station 2 and Station 3. So we have the district pretty well covered as far as geographic is concerned. When we put that third ambulance up on Syene Road, we thought that was probably going to be, was really in anticipation of the Southdale neighborhood coming in. And it really wasn't busy initially, but we've found as we start to track it that ambulance has been pretty busy. It hits Highway 14 for our intercepts up and down Highway 14. It gets all of that area that's new to the city of Fitchburg, and just increased call volume in general. So it's, we're covering those 4,267 calls with 21 full-time staff that staff those ambulances, and then about 14 to 16 LTE staff. Last year, we started to look at as far as recruitment is concerned, how could we do some internal recruitment, because finding part-time paramedics is really tough. And so we started looking at hiring as volunteers and opening up our volunteer system, as we did in the past, and putting volunteer EMTs and advanced EMTs on the service. And we have 4 of them that just pull a variety of hours. We don't have a lot of expectation as far as time is concerned. But if they go to paramedic school, and they can rotate into being an LTE paramedic, and that eventually will lead into full-time staff. So we have a wide variety of staff here, and along with that, the training that is involved with that.
Yeah, I think that's good to know, because it's it's hard to pinpoint how many calls when you're talking about that many calls, and you don't really know. That's split between 3 ambulances is incredible, and on top of all the other extra stuff you guys are doing in between with outreach and just helping the community out in so many different ways. It's a lot that is happening here. So you guys are making it work, but that's a lot. That's
Yes,
an incredible
it's
number
busy.
there.
Yep, it's busy. And in when COVID hit, we all kind of use that excuse across the world now, but when COVID hit, we stopped our outreach, and the plan for 2023 is to look at areas that we can continue to do some outreach into the community, working with the senior centers and working with the libraries, as we've done in the past. And that takes time. It takes hours of people's time to do that kind of stuff. So we'll be selective, just so that we don't burn our paramedics out, because ultimately our responsibility really is to staff the ambulances and to run calls. And secondarily, if we can provide some of that outreach to help our community, we certainly want to do that as well, knowing that we have to be somewhat fiscally responsible as we do that.
Yeah, well, and I mean the staff of Fitch-Rona EMS, Fitchburg Fire Department, Verona Fire Department, police departments of the various cities there too. I mean, you all attend different events, public ed events too. So not another form of outreach, but again, you're still working the ambulance at the same time that you're doing that outreach. So it's definitely a lot, and could not be more thankful for all the work that everyone is doing there at Fitch-Rona. Top calls for service, next category that always is interesting to learn a little bit more about, because it's one thing to you think, when people call 911, what are they calling for?
Sure. So top calls for service, usually they kind of intermix each other during the course of the year, but always on top of the number 1 or number 2 are falls. And that can be anywhere from a slip and trip on the ice to, somebody falling out of a tree. So that accounts for about 14 to 15% of our calls during the course of the year. I sit on the Dane County Falls Prevention Task Force, and so I know there's lots of groups looking at ways to try and reduce that. And I believe that if we pulled the statistics for the county, that's going to be one of the top 1 or 2 for the county as well. Breathing problems, sick person as it's categorized in our system, those tend to sit in the 2 or 3 spot for services, and that's usually consistent across the year.
Yeah, falls, since you touched on it, we've had some different guests on and different talking about it. Wisconsin leads the nation in falls,
Yes.
Especially over the age of 50, but just in general, it's not just because of the weather, folks.
Right. Yeah. And we talk a lot. You and I have talked on this show a couple of times about what adults can do, and it just doesn't incorporate adults, but what we look at older adults specifically, and the things that they can do to try and prevent those falls. And, we'll harp on it all year long, because, if I pulled the morbidity and mortality statistics on older adults and falls, and what the downstream effects of their health is concerned, it is pretty dramatic if you really look at what a simple fall for an older adult that is on a blood thinner and hits their head, what that could mean for them in the future. So it's really important that we pay attention to that. Even as much as we talk about overdoses and Narcan and the opiate epidemic, falls are a big part of it as well.
Jeff, following up on the training that you're going to go out doing some of the education, do you I'm going to say obviously, but I'm going to ask and like I didn't know, but you use a lot of the data that you're pulling in to help educate the community, right? So if we know if falls continue to be the top thing, then does Fitch-Rona say, okay, we got to continue our education in the falls area? How do you use that, I guess, the numbers to work some of that education components?
Yeah, we pull the data. I look at it monthly, more or less, on what kinds of things we could do to help prevent falls. Last year we focused on the opiate epidemic. We did last year we put the leave a dose kits out into the community, and we distribute those. I think that if it hasn't made a difference directly by leaving those kits, it's made a difference indirectly by bringing awareness to the problem when we arrive on scene, and it brings awareness to our crews who may not. I mean, I know they realize that they go on those calls and what the frequencies of those are, but by leaving that kit, it's an opportunity for them to educate either somebody that is using opiates, or a family member or a friend that is in part of that person's inner circle, that we can teach them and show them a way to say that program is now carrying out into the county, where other services, and I believe the city of Madison was looking at it as well as part of their outreach. So I'm really proud that we were part of that, and I think it'll make a difference. That came from statistics that we look at on a monthly basis. The same with the falls. It comes with statistics that we look at, and as part of the task force for Dane County that's discussed, we bring that EMS data into that discussion as well across the county.
Yeah, no, it's good information. Good to know. It can help kind of understand why and what you're doing when it comes to public education too. There might be some reasons behind that. You're like, why do they always do the same thing? Well, there's some numbers there that might back up.
Sometimes because people don't listen to us.
What are you talking about?
Yeah.
Final one, as we peek into 23 here, you guys do have some new things going on as well. You mentioned a few of the things coming up, but one of the new things on the ambulance this year is an IV push machine. Tell us a little bit about what that means.
Sure. So we always look for ways to increase our skill level and the proficiencies of our staff. We've looked at IV pumps, which is what we're adding to the ambulance this year. We've looked at ultrasound for cardiac arrest patients and determining, whether we should terminate resuscitations or not. The IV pumps were put into service in January after some training. They're really small. They're very easy to use. And one of the reasons that we made a decision to add those to the repertoire of the paramedics is that it does help with medication distribution, things like an epidrip or a norepidrip, where it has to have a specific drip rate in order to help with blood pressure in those cases. And in the past, in most paramedic units around the country, we'll look at it and count the drips that are going into the chamber, but that's really hard to do when you're bouncing down the road in an ambulance. So having those pumps on the ambulance allows for better calculation and better medication administration, which is safer for the patients. And it's the same for pediatrics. We have the pumps are pre-programmed that have our protocols in them. So somebody that is taking care of a pediatric patient that has to administer those medications, it's safer for the patient because they're using the pump, and that's the reason why we put them on there. So we'll expand some of that stuff as we move forward in the next couple of years and look for ways that we can better patient care, which is the case here, and give our paramedics, a good incentive to do that. Not that they don't do good patient care now, because they do, but this is much safer. So that's the plan for 2023, at least with equipment.
It's always fun
Always.
to catch up and talk about what's been going on out there. Another busy year. And again, thank you to you and the staff and everybody helping out there at Fitch-Rona EMS. Yeah, the staff is doing a wonderful job.
Thank you very much. We appreciate that. I will pass it along, and thank you to the community for all the support you give us. And obviously, if you have any questions about what we're doing at Fitch-Rona, where our plans are for the next couple of years, I know that Chief Anderson will have our annual report out here in a bit. Feel free to give us a call. You can send us an email. You can send me an email at jeffd@fitchronaems.com. We keep our Facebook page pretty active. The other social medias, I just need to work on that a little bit harder, but Facebook's much easier. So Fitch-Rona EMS on the Facebook page, and we'll try to answer any questions that we can for you.
All right. Jeff Dostalek, Fitch-Rona EMS, Deputy Chief there. So check out their website and follow them on social media.